आइए हम सुने विज्ञान की अनकही कहानियाँ। आइए हम सुने विज्ञान की अनसुनी कहानियाँ। एक नई दुनिया की आवाज़ आपकी आवाज़, विज्ञान की आवाज़, की आवाज़।
Celebrating Azadi Ka Amrit Mahotsav, we bring you a podcast series on STEM popularization, science, technology, engineering, mathematics and medicine, supported and catalyzed by the National Council for Science and Technology Communication, Government of India. This program is produced by Media for Community Foundation. Creative content and technical support is given by Purvasha Banerjee and Shushanto Das.
एक नई दुनिया की आवाज़ आपकी आवाज़, विज्ञान की आवाज़, की आवाज़, की आवाज़।
Vigyan Ki Awaaz podcast series aims to popularize new ideas of science and technology, which highlight STEM, science, technology, engineering, mathematics, and medicine. This brings to the surface the efforts and researches of Indian scientists, which is desired to bring a change in community learning and teaching, access to knowledge of resources, and social paradigms. Our goal is to spread the name of indigenous Indian research stories and their masters among the masses of society in a very easy manner. Bose Institute was set up in 1917 by Sir Jagadish Chandra Bose, the founder of modern science in the Indian subcontinent. It is Asia's first modern research center devoted to interdisciplinary research and bears a century-old tradition. The institute was founded as not merely a laboratory but a temple, with its principal aims being the advancement of science and diffusion of knowledge. Swami Vivekananda, Sister Nivedita, whose influence is reflected in the institute's emblem of Vajra, was significant in the setting up of the institute, and Rabindranath Tagore were among those who had consistently inspired and supported Jagadish Chandra Bose in his endeavors. Ever since the establishment of the Department of Science and Technology, Government of India in May 1971, Bose Institute has been an autonomous grant-in-aid institution of DST. Over the last century, the institute has endlessly strived to preserve the legacy of its illustrious founder. In this podcast, we are happy to present Dr. Anirban Bhunia, professor in Bose Institute. Before going into details about his research work, let us hear from his own voice about his academic journey.
I did my master's from IIT Mumbai in biotechnology, and then I went to Germany for doing my PhD, University of Lübeck, with Professor Thomas Peters. And after completing my PhD, I moved to National University of Singapore, and I was there as a research fellow for 1 year. And then I moved to Nanyang Technological University, Singapore again for 4.5 years with Professor Surojit Bhattacharya. And after completing 5.5 years of postdoc, in 2011, I have joined Bose Institute. After joining Bose Institute, I went to University of Michigan as a visiting professor for almost a year. So from 2020, I am professor at Bose Institute.
Dr. Bhunia speaks on his area of research, that is, on the mechanism by which the antibiotics kill the microbes, and then how his area of study expands.
My research is basically, I was started my research, it's antibiotics. So, antibiotics are basically the things which kills the disease causing microbe. Originally, my research focused on finding out the mechanism by which the antibiotic kills the microbes. So we wanted to develop the molecules specifically targeting the microbial membranes and make them more efficient. So in simple term, what I can say that the membranes are nothing but is like a boundary of the particular cell. So the more efficient they are identifying the microbes membrane from that of the human or the host, the more effective they are the antibiotics. So this interested us in studying the cell membrane, an important surface for several biological functions. So as I mentioned, in 2014, I got an opportunity to become a visiting professor at the University of Michigan, USA. So I got an opportunity to work many different scientists in Department of Chemistry and Biophysics. So I got an opportunity to learn neurodegenerative disease like Alzheimer's protein. So what we found that these proteins cause damage to the nerve cells by affecting the cell membrane, and the similar effects we also found or know that for the Parkinson disease and metabolic disorder like type 2 diabetes. So the cell membrane was crucial in all cases. So because when these proteins actually misbehave, then these proteins basically destroy the membrane, and hence the cells become toxic. So this made me interested in extending of my research into focusing on the membranes for this disease system. So I wanted to use my knowledge of studying molecules in action on the membrane surface and help understand the protein structure and how it affects the membrane. So this enable us to understand what protein structure is responsible for causing the nerve cell damage and leading to the developed drug molecules to prevent and treat the neurodegenerative disease. So here, basically what we are doing, we are trying to understand some of the early structure of the protein which are basically toxic to the cell. And based on this knowledge, we have developed a library of therapeutic molecules to target those toxic structure and prevent the neurodegeneration.
Dr. Anirban Bhunia speaks about his collaborators both in country and abroad, and also focuses his newest study on Ayurveda.
So I'm collaborating with many different scientists in the world, including Professor Ramamurthy, University of Michigan, and V.G. Sarojini in New Zealand. So there are many other scientists national level also. My colleague Professor Atin Kumar Mandal at Bose Institute also is helping me to understand the cellular level study as well as mouse model. And I'm very happy to say that very recently I have started working on Ayurvedic sample, Ayurvedic extract in collaboration with the medical doctor. This provided us an interesting understanding that these samples are treated by Ayurvedic doctors to the patients, and this study is underway, and we are basically designing this study from clinic to the bench, not the other way around.
Dr. Bhunia explains how his area of research contributes to the society and humankind as a whole.
As we already know, like type 2 diabetes alone accounts for more than 77 million people above the age of 18 years in India itself. And neurodegenerative disease, it is very common in Western countries. So we know that dementia, confusion, and movement disorderness are the main cause for this Alzheimer's or Parkinson disease. So in India, we know that more than 3 million people are diagnosed by Alzheimer's, and more than 500,000 Parkinson disease. So this is just Indian population, but the number will go much higher if we consider the global picture. So what we understand here that there is a link gut related disorder which actually started in the early life and that develops the neurological symptoms later. So this is, we have very nicely, we have identified very recently, and we are, basically that we have to identify or diagnose the development of this disease sooner, because sooner will be the better for treatment. And there are, in our TST, DBT and ICMR is giving fund for, they understand that importance of this research, and they are funding for this research heavily.
Dr. Bhunia speaks more on how he is doing his research.
I have started collaborating with a medical doctor, Ayurvedic doctor, and he is giving this sample to the patients. Actually, the doctors are giving to the patients and they are getting cured, but they do not know the mechanism. So actually here we wanted to know, this is not just collecting the data, we just wanted to know in-depth analysis. That what is because Ayurveda or herbal extract, there are several molecules are working. So if we can identify one or two molecules, or they are working synergistically, that way it is our interest. So if we can find it out, so maybe we can extract or identify those molecules later and can be used only for the drug.
The pharmaceutical companies will definitely be benefited out of this research on neurodegenerative diseases.
Yeah. So only problem is that, this neurodegenerative disease, there is no drugs at this moment. And mostly there are some startup companies are there which are doing, of course, clinical trial, but not many companies are associated. So in whole world itself, the neurodegenerative, there is no drug for the, let's say, Alzheimer or Parkinson. So of course, this research has a huge high value, and in future, if we can get some of the molecules, so that will be huge or high value in future.
Dr. Bhunia speaks about who are his global contemporaries and how their healthy collaboration leads to the same goal to serve mankind.
If you know that peoples are working all over the world on this neurodegenerative disease, and so this is, I would prefer to say that when all the focus is find to cure or to a disorder that affects human life at large. So it is important to realize that this is there is no competition between among ourselves. So instead there is a healthy collaboration, and we are sharing the knowledge between ourselves in the scientists all over the world. And of course, this is very important and essential. So the research had started long back, and significant contributions have come mostly from the United States, Europe, Australia, Korea, and China at the beginning. And we started later in comparison to the Western countries in this neurodegenerative disease. But we all have one intention to find the cure against this neurodegenerative disease and the type 2 diabetes.
We are thankful to Dr. Anirban Bhunia for providing us with his valuable time.